This is Pat Salber with the Doctor Weighs In, and today I'm talking to Emily Sopensky, who is a marketing communications consultant and an expert in the field of communications for emerging technologies such as RFID. But the reason why we're talking to her today is because she's also a part of the Intelligent Health Association and runs their awards program. So Emily, I think we'll start out by just having you say a few words about what the Intelligent Health Association is and how you came to be involved with them.
Sure. The Intelligent Health Association is this very large organization that keeps growing year after year, bringing in stellar people like yourselves who are so involved with the idea of intelligence and emerging technologies in the healthcare industry. It's such a, the industry itself is so scattered that everything that we can do to help folks get into more digitalization of healthcare. It's an awesome undertaking, and I think the association is doing a wonderful job in doing that. There's a lot of other hospitals and facilities that need this kind of help, so I'm happy to be involved with it. I got involved many years ago when Harry Pappas was involved with RFID in healthcare, and we formed a consortium, and it's morphed into the Intelligent Healthcare Association as we saw more and more opportunity for it. Harry took the lead, and he's just been gangbusters in trying to make this association work with anybody who's in the healthcare industry.
Well, before you go on, I just want to say that I'm new to the Intelligent Health Association family, and I'm very glad to be a part of it. And one of the things that is so attractive to me about the work that's being done is Harry's driving passion for transforming healthcare. And because of that, he has developed an awards program that you lead. And what I'd like to know is a little bit about the awards program, how it fits in with IHA's mission, Harry's mission in particular, and how you decide who gets these awards, because they're really important awards in healthcare.
We find that any organization, if it is to be taken seriously, you have to recognize those people who are doing the really hard work. And definitely the IHA has a driving desire to find those people and those organizations that are pulling things together that nobody else has. Making those silo entities, say in a healthcare facility like a hospital, getting them to work together so that they could find solutions that work for the patient care and healthcare delivery. The awards program was started up about 5 years ago. Harry tapped my shoulders because I also have a lot of experience with awards in organizations like the Institute for Electronic Engineers. And what we did was we put together a cadre of judges who have themselves quite significant credentials. For example, Professor Giselle Bennett is the associate professor for Georgia Tech. And we have a professor at the University of California, San Francisco, which is well known for its biometrics. We have a consultant in healthcare and education, Jennifer Mason. We have Sylvis Bent, who's been in the RFID industry for a very long time. And we have John Waltz, who's retired from Ameritech and is very active in IEEE. So this is a cadre of judges that has stood each year in taking the nominations that are put together by companies, by organizations, by individuals, that are sent online, and we review them once a year to see what who's doing what, and pulling from that under headings like the categories that we have in this competitive awards are innovative healthcare. What has an organization done that is innovative and is going forward? And if you don't mind, let me tell you who won it this year. It's an organization called Caretaker Medical. And what they're doing is in Charlottesville, Virginia, and they're connecting healthcare and professionals to patients at home. and they are doing ICU level accuracy and with predictive algorithms to identify critical sustainability in patients not usually picked for traditional using traditional methods, and they do this at home as well as within the hospital. So I think that's they're doing something that nobody else has been doing.
So I just want to say this is really exciting because years ago, I used to work with people who were at the cutting edge of employer health care. And one of the things that one of them talked about, he's now a professor at Stanford, Dr. Arnie Milstein, was this idea of hospital at home and ICU at home. And it sounds like you're giving this award to a company that's actually made that dream of having better, safer, more patient-centered healthcare at home come true.
And these are stories that, they live locally, but they don't really expand beyond. So the purpose of this awards program is to let other people know about it using, for example, what you're doing. Your blog goes out to a tremendous number of people. So we're hoping that these awards will get more notice, and people will be nominating some very, very important technologies that are being united through the various silos in an organization. The folks that are getting the Improving Patient Care and Health Delivery are York-Presbyterian, which is a very, very large organization. They've got 12 different emergency departments throughout New York City, which is a lot, and they treat over 310,000 people annually in their emergency departments. So what they're doing is using telehealth to treat people. So a patient comes in order to move patients ahead quickly. Those with a lower acuity, they can have the option of going into a private room and working with a doctor remotely with telehealth. And they can even have their papers, their discharge papers, and their diagnosis sent to them in that private room. And they've been able to reduce the average time of waiting from 4.5 times, from 180 minutes to 40 minutes for the average place. I know, isn't that amazing?
Yeah, I mean, more efficiency and more.
You're using something that you think of as for like remote, like an Indian reservation or something like that in the remote interiors, but they're using inside a really urban environment. I think that's kind of a novel treatment too. By the way, they're receiving our grand award, which I'm very pleased about. We have a new award this year. It's called the Pathstar Award, and we're trying to find those opportunities that haven't quite finished being tested out. They might be tested out, but still kind of like a prototype. We wanted to encourage more and more of these stories to come forward. So we talk about the potential for scaling up or transferring to other programs. And this year this is the first year. And it's an organization out of Boston, Mass. Called Medically Home. And what they're trying to do is create the equivalent of a temporary micro hospital room in a patient's home for 30 days with integrated remote and in-person care delivered to the person at a 30% lower cost. And their whole idea is that hospitals have a really high fixed cost, and they have to kick patients out pretty early in a lot of cases because of the rules and the regulations that are being set in Washington, D.C. So how do we extend the patient in home at a hospital level care? So they're doing that through a program that they've created, and it's not quite there. I mean, they haven't had a lot of opportunity to try this out, but they do this with a clinician on demand through video, voice, or text. And in addition, they have interdisciplinary care teams of nurses and nurse practitioners and doctors available on call for this. So I'm not exactly sure how this is rolling out, but the fact that they put this together and they're going for it, I want to see how that works out. So that's why we have the Pathstar Award, so we can come back and visit it and say, wow, we heard about this here, and we're so glad to see that they're going forward and they're really gaining mass in their implementation of that. So that's what
it's doing is what I love about all of them, but that one in particular is it really is transforming the healthcare.
Yeah.
And for anybody who's ever been in the hospital, I can tell you that being able to be at home and know that you're getting safe and good care is so much better than being in a hospital room where someone's taking your blood pressure every 4 hours or
Oh, I know, they keep you awake. They wake you up in the middle of the night.
yeah, they interfere with getting better. What else you got?
No, there's one other category, which is a real tough one because it's a combined of some of these. It's called combination, basically. That's the short term for it. And it's a tough one to apply for. So we haven't seen anybody in 2 years, but we'd sure like to see somebody apply for that. The form is on the Health Association website. And I think it's up there for 2018. We'd like to keep it up there so that people can go look at that and think about it and come back and fill it out towards the fall so that they can apply.
Well, it sounds fantastic. So, Emily, I look forward to seeing you at HIMSS, and I want to thank you for joining us today and sharing the information about the awards program. And congratulations to all the winners.